One of the common terms that you may have heard of is a crown. People say, oh, I need a crown on my tooth, or my dentist has told me I needed a crown on my tooth. And a lot of times there's some confusion about what that really is and why you need it and what it does. So let me just take a second to explain some of that. So a crown can be thought of like a helmet or a cap, a thimble that fits over the top of the tooth. When there's a lot of tooth structure missing, the remaining tooth is quite weak. And when there's not enough rigidity in that tooth, a filling will not stop the tooth from cracking. As a matter of fact, a filling really relies on the remaining tooth structure for the rigidity to hold it in. And so when you're missing a fair proportion of the tooth, and if you think of it as around about a half of the tooth above the gum, or a third to a half, there's not a lot of tooth structure left there, and certainly not enough to hold a filling in place and stop the tooth from cracking and breaking. And cracking and breaking teeth is one of the main reasons that people lose teeth. So often a dentist will say to someone, you've got some problems with this tooth, there's a crack in the tooth, there's some decay in the tooth, there's a big old filling. My recommendation is to have a crown. And people think, well, they could fill it last time, and they probably could, but things change, and usually not for the better. So that's why often dentists will recommend a crown. It's to make things stronger. It's to try and minimize the risk of any further complications, and to do something that's durable, that will help you to keep that tooth the rest of your life. One of the other reasons that dentists can recommend a crown is when there's a lot of tooth structure missing, it's technically very difficult for the dentist to build the shape of that tooth correctly, so that it's easy to clean, so that it functions properly, so you don't get food caught down between that tooth and the next one and have problems with the gum. As clever as dentists like to think they are, there are limitations to how well we can shape things. And so sometimes it's better for the tooth to have something that's made not on the tooth but outside of it, and then put on the tooth, like a crown or, as I said, a thimble or a cap or a helmet over that tooth to rebuild that shape properly. It's going to save a lot of treatment down the track. It's going to be a lot more durable, and it's going to function a lot better. If you do need a crown on your tooth, this is what you could expect. So the dentist will usually take out all of the old filling, and that's important that you take all of it out so you can see exactly what's going on underneath. You should never assume that everything's good from before. Things changed. In the past, often things were done that are no longer acceptable. So all the old filling is removed, any decay is removed, and these days we commonly will use a dye to stain the bacteria in the teeth so we can be 100% sure all the decay is gone. Usually, not all the time, but usually when there's a lot of tooth missing, we need to build up what's called a core, which is like a filling that acts as a foundation for the crown. And that's placed in the tooth, and then there's some sort of impression taken, either a scan, and these days we've got 3D cameras we can use to do that digitally, or in the old school way of taking a mold of the tooth, and then that is used to fabricate the crown on. If we're doing it 3D, many times we can do it at one visit, and there's lots of advantages with that. Obviously, time for the patient, they have to go back and come back again. You don't need to be numb twice. But even for the dentist, technically there's advantages with the bonding of the crown to the tooth, because the dentine is what we call fresh. It's not contaminated, and so it's much better if you can, if it's appropriate, do it at that one visit. If not, as I said, the old school way is, you pop a plastic temporary cap on the tooth that holds everything in position and protects the tooth, and then a couple of weeks or months or whatever later, the patient comes back in and that plastic one's taken off and the real one's put on. And crowns can be gold or ceramic or a mixture. These days, most, about 80% are all ceramic, and there's big advantages with that as far as strength and also as far as appearance. Nevertheless, gold still has its place in some cases. You know, I have some of each in my mouth. It just depends on the clinical situation as to what is going to serve best. So you've probably heard of the term a dental bridge, and like any bridge, it's something that spans a space. So usually you've got a tooth missing and some teeth either side, and if you want that tooth replaced, there's really only three options. A partial denture, something that comes in and out, and you put it on your bedside table or whatever at night, and they can look good and they can fit well, but they're not like chewing with your own teeth. You lose about, depending on what research you believe, about 80 to 90% of the chewing power with dentures, and they tend to feel bulky, and they have their own problems as far as cleaning and the clips and the rubbing the gum around the other teeth. So, but they're, you know, they have a place. They're low cost and they can look good, as I said. And sometimes they're the only answer. The second option is an implant, where we put something into the bone and then the bone grows onto that and we build a tooth on top of that. And to do that, you need the bone there. And sometimes, especially if the tooth's been gone for a while, the bone's not there. Or there's been infection that's eaten away at the bone. So implants are good, and they certainly give you, you know, close, not as good as your own teeth, but close to your own teeth chewing power. But sometimes you can't do that. And we've had patients that have had seen specialists and had bone grafting and so forth to put implants in, and it hasn't worked out. And so nothing is 100% success rate, even in the best of hands. So implants are an option, but sometimes they're not suitable as well. The third option is a bridge. And you need a good tooth either side normally for a bridge. And it's like you're having a crown on one tooth and a crown on the other tooth and a false tooth in the middle, and it's all joined together. And that's been a very long-standing way of doing things. Bridges have been around for 100 plus years, probably more. And certainly, you know, I've been doing it for 40. So bridges are something that is tried and true. Again, you need strong teeth either side to take that extra load, so it's not something that can be used anywhere, and there's limits to how long the bridge can be. But it can be very effective and very durable. My sister broke one of her front teeth, and I went through those three options with her. She didn't want to. I suggested an implant would have been ideal. She didn't want that. So she told me she didn't want anyone drilling a hole in her head. So we did a bridge, and that was, goodness, 10, 15 years ago. And it's as good as gold. She comes in every 6 months. So, you know, bridges are something that are very durable, very lifelike, very comfortable, and they're an essential part, really, of any dentist's armamentarium to help people. The treatment for having a bridge is very similar to the treatment for having a crown. You prepare the teeth, you take out all the old fillings, you build up any foundation work that you need. You get in the molds or the scans as you would for a crown. Usually with a bridge, it's done in 2 visits. Sometimes we can do them in 1 with CAD/CAM, but more commonly it's done in 2 visits. And that's because there's much greater technical requirements, because the scope of work is a lot bigger. It's, you know, 3 times at least than for a single tooth crown. So again, a couple of visits, it's nothing to be concerned about. For the patient's perspective, it's like you're having a filling, you're numb. Things happen, you get a mold or a scan, you take some Panadol when you get home, everything feels okay the next day. And then a couple of weeks later, you come in, the temporary bridge is taken off, and things are fitted and glued into position, and that's everything done.